How does someone choose hospice care? Is it me, the hospice nurse, persuading them with information? Not so much. A meaningful conversation about serious illness can really help patients and families reflect on their hopes, ensuring that their decision aligns with their personal goals. So how do we get that conversation going? Let's say we evaluated a patient for hospice. They're fully appropriate and eligible based on Medicare standards, but they just don't know what to do. Either the patient or perhaps their loved one is just sitting on the fence, and there's some fear of hospice, and that's what we all face in the hospice world. Let me just say that, Brenda and I could sell anyone into choosing hospice to be admitted. But is that really what we want to do? No, we don't want to wring their arms, so to speak. No, we want a person and a family to follow their own decision and choice path. We want them to choose what is right for them. So how do you help them choose that? It takes more than just facts about hospice care. Having that serious illness conversation with the patient and family can help them understand the present status, look forward, and make their own decision based on who they are. So, how do we get this started? It really takes asking the right questions and then listening carefully. If possible, find a time that is unrushed, and if possible, make it in person, not a phone call. Now, how do you get the ball rolling? You ask open-ended questions. What is your understanding now of where you are with your illness? Sometimes patients have been afraid to ask pointed questions to their provider. They're afraid of the answer, and so they don't even ask, and they're not sure. In all honesty, having conversation about terminality is very difficult, and some providers even have not had training or very much experience in talking about a terminal condition, so they don't volunteer clear statements when there is a terminal status. In our culture, generally, we have trouble directly facing those hard statements. Fortunately, those of us in hospice care are more comfortable talking about death, so we can easily open this discussion. So it's important to know what the patient understands about their status. After you know what they know, then let's continue with, have you asked your provider what is likely to be ahead with your illness? Then start to open the questions and the conversation more directly to their own goals. You might ask, if your health situation worsens, what are your most important goals? Or, what change in your condition would be critical to your quality of life? For instance, when a patient faces the inability to walk, this might be a total game changer in their decision to come onto palliative or hospice care. Asking what their biggest fears and worries are can help offer information from us so that services then can be there to support them. It takes asking questions that elicit the person's goals and hopes. We in hospice always have the information at our fingertips regarding facts about hospice. We've got the information, we've got the statistics. We know that patients will live longer and more comfortably if they choose hospice. But it is the emotions that lead us to our decisions, and you will be able to understand and support the patient's choice if you have a conversation about their feelings. It's also important to know about how much the family is involved in knowing the patient's goals and priorities. Sometimes patients will face these choices based on what they think their family wants, but they may not have ever talked openly about it with their family. Their assumptions are often very incorrect. As I said to begin with, Brenda and I can pretty much sell anyone on the benefits of hospice, but we've come to a feeling that it's not to benefit the patient or the family or us if they're not emotionally ready. So sometimes we recommend they don't come onto hospice even though they're eligible, because they really aren't ready emotionally. If the patient and family are pushed and forced to be admitted, then they're often not open to the suggestions and options we have regarding their comfort. It ends up being a wrangle. Space is important. Have that serious illness conversation. Stay in connection. Often the patients are then reaching out to us when they're ready. Thank you so much for listening. Please go to our website, the Hospice Care Plan, and get our booklet. We talk about all these types of things in our booklet, and we have many, many videos at the Hospice Care Plan on our YouTube channel. Please remember our motto, care is treatment.